Welcome to the Wonderful Therapist podcast. I am Juan Gutierrez, your host and associate clinical social worker working under the supervision of a licensed therapist in California. In this podcast, we talk about psychotherapy, mental health topics, and have inspiring conversations. My hope is to talk about therapy and make it feel more normal and less intimidating. I provide therapy and I have received therapy myself, and I know that it is a great tool for our healing and betterment of ourselves and relationships. If you're interested in mental health and related topics, you're in the right place, and I am happy to share information with you. Just one quick disclaimer: the information provided in this podcast is not substitute for mental health services. Any statements and opinions I make are representative of myself and separate from my employer. Please share this podcast with friends and family and provide us with feedback or suggestions for future episodes. With that said, thank you for tuning in. Now let's have a wonderful time. So it's been a while since the last episode. Being completely honest, and I mentioned this in an earlier episode. I think the first one. I have a baby. We have a 10-month-old baby, and sleep has not been the best. So I've been taking advantage of all the spare time that I have at home and at work, especially only actually during lunch, to just take quick naps and recover some sleep. So I haven't been able to record or to produce more episodes. Also, work has been super busy. So yeah, it's just life. Life got in the way a bit. But in today's episode, we'll be talking about the fear and obstacles related to starting therapy. I chose the words fear and obstacles for the following reasons. For the most part, fear stops us from taking action about something, and obstacles are in our way of our path. They get between our end goal, our destination, and ourselves. So they obstruct us from continuing. So I believe that there is both subjective and objective reasons to not participate in therapy, and it's not a clear cut reason or definition or one or the other. It's typically an enmeshment and a combination of subjective and objective reasons. But fear and obstacles. Fear, I believe, is more of a subjective reason to not be in therapy. Obstacles, I believe, is more of an objective reason to not participate in therapy. But I'll try to address it. We're going to break down the motives, the reasons, in 5 points. They're not in specific order, but the 3 first ones, they're somewhat linked to each other. The last 2 are, I would say, probably the most influential, but again, they're not in specific order. Like, the first one is the most influential one or not. They're just kind of in a random order. The first one is knowledge. Knowledge is one of the reasons as to people do not participate in therapy. And now, I truly believe that there are some people that sincerely do not know, do not understand how therapy works. And I'm saying this with the most respect and the most respectful way, is that there is some misunderstanding of what therapy is and how therapy works. And because of this, people don't access therapy because they have a misconception of how it works. Or just plain simple, they don't know when to start therapy. For example, when we become physically ill, we know there's something off with our body, and we're able to identify the symptoms. So what do? We go see a doctor. We seek medical assistance. Why? Because there is a physical symptom that we tangibly feel or see. And therefore, we know that that's our cue to seek medical assistance. However, what about when the symptoms are psychological or somatic? Now, somatic means that the symptoms are influenced probably by a psychological reason. So, what happens when the symptoms are not visible? What happens when the symptoms are not in a specific part of our body, or a specific part of our body is not working properly, or there's not pain in a part of our body? Then we really don't know what to do, right? Like we don't know what to do. And to be honest, most of us, we don't know how to identify symptoms of depression, anxiety, or other mental health conditions. We may get confused or have a misunderstanding. But that is why mental health professionals are for. We are trained to identify those symptoms as people are talking to us, as we observe people's behaviors. We're trained to identify those symptoms, but we don't know we don't know who those people are unless they come to us. We're not like emergency responders that go to a accident, let's say. There are therapists or mental health professionals who work on crisis response, but even that, it's a very specific situation. So the typical individual, I would argue, that don't have a full idea or comprehension or ability, that's a good word, ability, to identify the symptoms of depression or anxiety or other mental health conditions. And because of that, people can, don't know when to access services because they are not able to identify the symptoms, just because there is a lack of knowledge about psychological symptoms and lack of knowledge of how common and normal these symptoms are and how curable they are. And even if there is the knowledge of the psychological symptoms, there's also underdiagnosing and overdiagnosing. That's why the mental health professionals should be the only ones, and actually the only ones legally, to be able to diagnose mental health conditions. It should not be done by, someone who doesn't have the appropriate training or credentialing. That should be. You should only be receiving a mental health diagnosis for a mental health professional. Let's just say it that way. So if a regular person has a bit more knowledge on what psychological symptoms look like and feel like, then they'll be able to know where to go, who to talk to, and what to do. So that's the first one, is knowledge about what the psychological symptoms are that will lead you to be in the need of therapy. The second one, and this is going to build on the previous one, is the access to therapy. I believe this is more of an obstacle because access of therapy is very different across our nation and just across any country. So let's assume the person has the knowledge and knows that they want to start therapy. So how do they access therapy? Well, this is, again, it's a quite complicated answer because it looks different in various places, from city to city, from state to state. So let's go on with the assumption that the individual knows that they want to participate in therapy. They have identified a symptom. They have identified an impediment, a need, so they want to move on with therapy. Now, now we're starting to get into the realm of the access to providers and the financial means to access the service. And some people don't know that they have access to the services. Some people, don't know that their insurance provider covers therapy. Some people just don't know how to access, where to go, who to talk to, who to ask for. Can I talk to my doctor about this? Can I mention it to, someone at school? Like, sometimes just people don't know where to access therapy. However, luckily, nowadays with the internet, we're able to ask a quick question. Do I need therapy? Where do I go to find help? I feel depressed. I have anxiety. And those searches will typically lead to a type of map or route towards a mental health service. That is by an advertisement, or by reading an article or a post or watching a video. Hopefully will lead you towards, hey, you need to talk to a therapist. This is where you can seek such help. And that is one of the probably biggest benefits of the internet now, is that we can just search for anything, and one of those anythings is therapy services, how to access therapy. In some cases, you can, be guided by your doctor, the hospital, by other medical professionals that are familiar with therapy. They can point you in the right direction. School staff, at work, they can provide us with resources. So the access, in theory, is quite available. It's just knowing how to access the service that is the obstacle. So, moving on to the third point, it's the process. Someone knows they need therapy. They have access to the therapist. Then there's the fear of, what does the process look like? Am I gonna, go through X, Y, or Z? Am I gonna get sent to a certain place? What does it look like once you become aware they need therapy, and once you're willing to be in therapy? The process. That's another element that stops people, the fear of the process. So I will be speaking in general terms, because the process of initiating therapy looks different in many areas and many situations. So in general terms, once a person has set course in starting therapy, they will contact or make some type of contact with the mental health professional. And then after that contact is made, the mental health professional and the individual will agree to meet and have an assessment or an evaluation. In that appointment of evaluation and assessment, the mental health professional and the individual will have a conversation. What's going on? What are the symptoms? What are you going through? What's the situation? What's the problem? What's the barrier? What's the challenge? Just ask your questions to gather as much information as possible. Tell me about your history, any traumatic events, any relationships, or interesting dynamics. And in that assessment, the mental health professional is trying to get a broad picture of the person and identify the patterns that are influencing the behavior, and then ultimately identify the area that is being affected by the symptom. Once the impairment, we call it, so the area that the person is having a challenge with, once that area is identified, then we move on into identifying goals. And once the goals are agreed between the therapist and the individual, they move on into scheduling. And sessions are established, and therapy begins. The process sounds simple, right? Well, in theory it does, but it can be quite lengthy, especially now in the US. As of June 2023, when this podcast episode is being recorded, there is a shortage of mental health professionals in the United States. So that means that there is wait list and a waiting time to begin therapy services. It has increased. Also therapists that speak a language other than English are quite scarce in the U.S. So that's another obstacle. And again, subjective and objective obstacles, challenges are intertwined. They're mixed. There's not a clear cut. And then coordinating and scheduling sessions is challenging as well. You're coordinating the schedule of two people that have things going on throughout the day. And to find that match, that also takes effort. So the process, the length of the process, the severity of the process can be an obstacle to engage in therapy, because it takes effort. It really does. It takes a lot of effort and a lot of energy and time and resources, of course. Number 4, stigma. This is a very influential one, because there is still the belief out there that if you need mental health services, there must be something, quote unquote, not right with you. And I believe a lot of these beliefs come from the time of Sigmund Freud and psychiatric hospitals and cultural beliefs from each individual. So Sigmund Freud, just very quick history, was a psychiatrist, a medical professional who pioneered psychotherapy through psychoanalysis, meaning you talk about what was going on, and psychoanalysis finds patterns from your past that are influencing your present behaviors, and then you're supposed to go back to those patterns to fix them in order to fix the present. That's a very broad and simple way of explaining psychoanalysis, but all right. So there's still a lot of that belief that you're going to be sitting on the couch in a dark room and just talking to a person who is writing stuff on their notepad, and that sounds scary for a lot of people, because of that image. People don't want to go to therapy because they don't want to look like that person in the couch. And then psychiatric hospitals. Those used to be quite more popular in the mid-century. And that was when people will be hospitalized and kept in psychiatric hospital because of their mental health conditions, but also in some cases presumed mental health conditions. And In some cases, they will be held against their will. So there's that stigma of, if I speak about my mental health problems, challenges, I may be put in one of these hospitals. And that's not true. That's like not true at all. It takes a lot, and a high severe impairment and severe symptoms, for a person to go to a psychiatric hospital. And we try to do voluntarily first. We offer it, and then if the person is at risk, we may move towards involuntary, but that's more towards the safety aspect. It's quite confusing, but the stigma is out there. And there's cultural beliefs. I'm Hispanic, and in my culture, and for my country in Mexico, there's this label of el loco, the crazy one, that if you deviate from normalcy, you're considered the crazy one of the town, of the city, of the block, of the neighborhood. And you're just the crazy, the one that people make fun of, the one that parents use as a weapon to scare their kids. If you don't eat all your food, the crazy one's gonna come get you. So there's that stigma of like, I don't want to be that person. I don't want to be the crazy one. And it's such a horrible label, but it's still out there. Oh, believe me, it's still out there. And there's the stigma of being labeled, being diagnosed with a mental health condition and given a diagnosis. Some people don't want to accept it, and then two, just they don't want that quote unquote on their record, because of potential repercussions. And that's not the truth. It's such a stigma, such a interesting way of believing that if I'm being labeled with a mental health condition, there's all this other like negative consequences that are just gonna impact the rest of the course of my life just because I had this one label. And that's far from truth. Last one, and I think, me personally, I believe this is probably one of the most influential ones: vulnerability. It is very difficult to open about our inner struggles. And when I say very difficult, I mean very difficult. It's uncomfortable. I think as human beings, we do not want to talk about our inner struggles. We feel exposed and fragile when we talk about our personal problems, weaknesses, challenges, fears. It's such an exposure to grab all of that and put it out there for someone else to do what with it. And that is a question that a lot of people have a hard time overcoming in therapy. Is, if I tell you this, what are you going to do with it? Are you going to judge me? Are you going to tell my parents if they're minors? Are you going to tell my spouse? Are you going to, turn me into the authorities? What are you going to do with this information? And sometimes there's just shame, embarrassment, guilt on a lot of the inner struggles that people have. And to talk about that, it's difficult. It's very difficult. It's not easy, but when it's done in a safe therapeutic environment, it is very relieving. It is very, very relieving, because there's this sense of freedom when you process that information and you overcome it and you come out on the other side uh, with a better result. Is just so much better and such a healing process. So vulnerability, it is one of the biggest influencers of why people do not access mental health services, because it's such a challenge, personal challenge for someone to overcome and to talk about the struggles and what's going on in their life, in their mind. It's yeah, it's scary. So those are the five fears and obstacles for someone to access therapy. So I hope that by you like understanding or hearing about this, it can normalize some of them and hopefully help you make that decision towards seeking help. And if you're a provider, hopefully some of these discussion points can help you, talk with your clients or potential clients about this. I would love to hear other points. So if you can just, let us know. But in the next episode, we're going to talk about what to expect on an actual therapeutic session, on a therapy session. I know I briefly talked about it on the third point on the process, but next episode, we're going to dive in a bit more on what does it look like to be in therapy with a mental health professional. So thank you so much for tuning in this week. I will try my best to keep on recording and producing this podcast on a timely schedule and not being all over the place. So thank you for tuning in. Have a good one.